EdHeads is an interactive online resource for students that focus on math and science. This particular website, you can do different games that focuses on the second through the sixth grade level. Today I'm gonna do a demonstration on simple machines. So this is simple machines. You can learn about simple and compound machines while you explore house and tool sheds. So I'm going to click on start, and then it pops up. You click on the house, and for this particular activity I'm just going to do the bathroom.
Hey there, come on in. This is my bathroom. Oh, don't worry, I just cleaned. Why don't you have a look around and try to find and identify all 10 simple machines.
So it's 10 simple machines in the bathroom. And I'm going to press start. The first machine I'm going to do are the screws. And so basically it asks a question. What do the bolts on the toilet do? So then you choose your answer. Attach the toilet to the floor. Then you press continue. What type of simple machine is a bolt? And because I'm not really sure, I'll still choose screw, because it looks like a screw. And then it gives you what it does. The bolts on the toilet are screws. When you twist the bolt into place, they fasten the toilet to the floor. Then you press continue. So after you finish each simple tool, it gives you a demonstration, and that was the demonstration. So I'm gonna press this. I'm gonna call it a flusher. What does the handle on the toilet do? So it's a handle. Does it flush the toilet, turn on the sink, start the microwave, drain water out of the bathtub? And I'm going to flush this toilet. Let's see what happens if I get the next question wrong. What type of simple machine is the handle on the toilet? Is it a gear, a lever? Well, you see all those. I'm going to say it's a wedge. It's wrong. So it gives you an option to try again. And I got it wrong again, and it's actually a lever. And then it shows you. It demonstrates how it works. Okay, and that's it for simple machines, but I'm just gonna click on each one. You have the toilet roll. Oh, I stopped it. So I'm gonna go to start again, and then let's choose we've done simple machines. That was simple machines. So let's go to virtual knee replacement surgery. This is kind of graphic when it gets to showing you how to do knee replacement surgery. It actually shows you how to do knee replacement. And I'm going to choose the virtual surgery.
Welcome to virtual knee surgery. This activity will show you the process of replacing a failing knee joint. Are you ready? Today, our patient is a 76-year-old man. It is mandatory to check the patient's vital signs before beginning surgery. An anesthesiologist in the operating room performs this step. If the patient's vital signs are not in the normal ranges, we will not proceed with the surgery. Using the healthy person's vital sign chart as a reference, can our patient undergo surgery today?
Okay, then you click on the answer.
It looks like surgery will proceed as planned. Take a moment to look at our patient's x-rays. Which knee do you think needs surgery?
And I'm choosing the left
You're right.
knee.
His left knee appears worn down and lacking cartilage, which is likely the cause of his pain. The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand. Now it's your turn. Use the marker and write your initials on the proper knee to be operated on. This may seem silly, but it's an actual step taken to prevent wrong site surgeries. The anesthesiologist administers drugs through the IV and through a mask over the patient's face. What function should these drugs perform?
Okay, so basically you go in and click the ones that it does the anesthesia
Good work.
will do.
Great.
For the patient.
Nope.
And as you can see, if I
Fantastic.
get it wrong, it tells me no.
After the patient is unconscious, and before the first incision is made, we need to establish a sterile field around the surgical area. A series of sterile drapes isolates the surgical field from the rest of the patient's body. A tourniquet is applied to cut off blood flow, which allows a clearer view of the surgical field during surgery. To kill the bacteria on the patient's leg, clean it in a betadine solution. This scrubbing process will limit the chance of bacterial infection.
Okay, so then you go through and you choose the sponge. You dip the sponge in the water. I think it was iodine or, I don't know, betadine. So you cover the person's leg in it. So this is a
Betadine scrub is applied 2 more times, followed by the final arrangement of sterile drapes. Why do you think knee surgery involves so many drapes? Good work. Use the sterile marker to draw the location for our incision. And don't forget to mark the perpendicular lines too.
Okay.
Typically, the incision line is 6 to 7 inches long.
Okay, so we actually about to this is very interactive for 7 through 12 graders. I'm not going to go through the whole
What purpose do
surgery.
you think the perpendicular lines serve? Nope. No. Outstanding. Now for the incision. Take the scalpel and cut the skin following your markings. Let's use the Bovie pencil to cauterize the veins. This will help decrease blood flow into the surgical field.
And this is me actually doing this. Performing knee surgery.
The rake retractors fold the skin and tissue out of the way, exposing our patient's knee. To operate, we need the patient's knee elevated and bent so the bones are fully exposed. Now the leg is at the proper angle. Use the rongeur to remove the anterior cruciate ligament, or ACL, the meniscus, and any bone spurs that may be lurking about.
So I clicked on it and I'm clipping.
Are you a good sculptor? It's time to shape the femur, tibia, and patella so the new knee components fit properly. A hole must be drilled inside the femur to set up the distal femoral cutting jig and alignment device.
Okay, so this will be the last step that I show in this particular activity.
The jig is put into position and helps ensure that the cuts made to the bone are exactly what are needed. Now hammer in the pins to hold the jig.
Okay, so now I'm just gonna close this one out because you kind of see each activity is like very interactive and it's detailed. So the website is edheads.org, and this is again a website and not an app. Teachers can use it in their classroom, or students can use it at home to kind of see what they would like to do if they would like to be like a doctor or a brain doctor or a plumber.